All right, welcome back to Health with Hashimoto's. I have a guest for you today, and today I am releasing it as a bonus episode, not going on our traditional Thursday releases because I want you to have this information ASAP. I am interviewing Danielle from New Health, KNEW Health, and this is a health sharing program. So, not insurance, but like an alternative. And I'm going to try to get all of your questions answered. If you listen to this whole interview and you don't get a question answered, I will tell you from personal experience, you could just call up the company and they are super friendly and will answer everything. And then also stay tuned to the end because I have a ginormous discount for you if you choose to use this company, and also just good information as you look at any company. So, welcome, Danielle. Tell us a little bit about yourself and then what is a
Sure.
health sharing company?
Absolutely. So my name is Danielle. I am on the member care team at New Health, and I'm also part of the New Health community. My role really is to just answer questions for prospective members and really help them figure out if New Health is the right fit for them, for their family, for their business. So, what we do at New Health, we are actually an alternative to health insurance. And it's typically more affordable, way more affordable for some people. And really, the whole concept is where our members contribute a monthly amount, which goes into a community fund. So that when someone from our community has a medical need, it's paid for through the fund. So the concept's been around for over 50 years. So we're not like the first people in the industry, but I like to think that we've perfected it. Most other health shares are religious based. So a lot of them have their members take, like, for example, an oath of, say, Christianity. Whereas we are not religious based, we're inclusive. So that's something that sets us apart. And we don't have network restrictions. So our members can see any doctor anywhere, whether they're alternative or traditional. We really leave it up to everyone to decide their care.
Yeah, I know when we were looking at health insurance this year, we had a price increase. I talked to a friend and their insurance through, I believe, work. She said this next year it was going to be triple the rate of their mortgage every month, which is
Wow.
just crazy. And so I started looking at all the different health sharing companies. I do have experience with some of the religious ones, not personally, but family members. And
Yeah.
I felt like now, I'm a rule follower. I want to know the reason behind the rule, but I'm a rule follower, so I get it. But I feel like a lot of the religious companies have a lot of rules that you have to follow
Yes.
in order to meet their criteria. And with New Health, when I talked to you guys on the phone, I felt like you wanted the best for me and you believed that I was pursuing the best. Is that
Oh, I love
accurate?
that. It is. It really is. So the founder of New Health, his name is Joshua Rosenthal. He actually started the Institute for Integrative Nutrition. So some listeners might be familiar. It's actually the world's largest holistic nutrition school. They have over almost 200,000 graduates now in nearly 200 countries. And the whole focus of the curriculum is teaching people that health is more than just about food, and that people can do so much more than their yearly doctor's visits. And they actually train people to become health coaches. So he was always in the holistic world. And he always would say in the curriculum that our healthcare system is broken and that it's just not working for millions of Americans, especially healthier ones. And so he sold IIN. And when he did that, he decided that New Health was going to be his next baby. And he took on this whole industry, saw what wasn't working with other health shares and really made it work. Something that we pride ourselves on is our customer service. I think calling insurance in general is a nightmare. I had to take the day off when I had health insurance to get through to them. So we really pride ourselves on customer service, but also preventative care. So we share in more preventative care than any other health share. So Joshua's goal was really to do as much as he could to keep the community healthy, to avoid the illnesses and injuries that come, down the road. And we haven't taken a price increase in a little over 6 years. So it seems to be working for everyone, for sure.
That is incredible. I know one of the things when I talked to you, somebody mentioned thermography, and I have chosen to
Yes.
do thermography instead of mammograms. After looking at all of the research, I decided that for me. Um, Tell me about that kind of wellness because I don't see that anywhere else where they're like, "Oh yeah,
Hmm.
go get thermography."
Yeah, yeah. So like I just mentioned, it's something we really want to prioritize for everyone. So as soon as the membership begins, we give everyone several allowances for various preventative health services that we just reimburse you for up to the allowance amount. So every person gets an allowance for an annual physical. We do another one for a well woman exam and pap smear, one for a mammogram or thermogram or ultrasound, one for a colonoscopy, any immunizations you choose to do, STD testing, and birth control. So, for example, a physical is a $250 allowance. So you would just tell your doctor your self pay. You get an itemized receipt, submit it to us, and then we reimburse you up to 250 since that's the allowance amount for a physical. We also reimburse super quick. It's just 1 to 2 weeks for a check, or you can set up direct deposit. I've seen that hit my account in just a couple of days. So it's very fast. And we also do extensive research every year as to what these services cost for self pay patients. And the amounts that we've set forth are actually a little higher than what the national average cost is. So you really shouldn't expect to have to come out of pocket, for anything beyond that. Something else I want to mention is our blood work allowance. This one is really unique. I haven't heard of anyone doing what we do with blood work. So, believe it or not, blood work tends to be something that most doctors upcharge by sometimes 95%. I don't know if you've experienced it. It's crazy. But in order to keep the cost down, we actually have our members order their own blood work through a company called Evexia. Evexia sends you over to your local lab core, and that's where you get your blood drawn. We give you some panels for free. So the most common ones a doctor wants are usually the CBC, the metabolic panel, and insulin. So our members can order those for free through Evexia anytime. And then everything else is wholesale priced. So you're going to see labs in there for like $4, $8. A thyroid panel is $15. And we reimburse each person up to $80 a year, but you also don't need a doctor's order for anything. So if you are just curious about your thyroid or your estrogen, your cortisol, you can just order it and you get the results directly. And then the last allowance I want to quickly mention is a self care allowance. It's $200 a year. It's the only one a family would share, but you can use it for pretty much anything self care related. You can get reimbursed for the chiropractor, massage, gym membership, vitamins, supplements, acupuncture. It's totally up to you how you want to utilize that one.
That is all so incredible. And for anybody listening, I have done a couple podcast episodes about ordering your own labs and what to look for. I also compared prices for ordering your own labs. I looked at, I think, like 4 or 5 different companies. I
Mm-hmm.
did not know about, what did you say? Evixia? Is that what
Evexia.
Evexia?
Evexia.
Yeah. And so
Mm-hmm.
I looked at the prices after talking to you guys, and it is cheaper than anything I have been able to find. So I can't wait for my membership to kick in. I chose we so we enrolled during my husband's open enrollment
Yeah.
back a couple weeks ago, and then we sent an email, as you guys say, to pick our start date because our last year's
Mm-hmm.
insurance goes through the end of this year. So January 1, I am going to be taking advantage of all of those different perks.
Yay.
Yes, I'm super excited.
Absolutely.
So is there anything that we haven't covered as far as the similarities and differences between traditional insurance and a health share company? Like whether it's yours or any health share?
Yeah, I mean, so we definitely do things differently when it comes to illnesses and injuries, right? So everyone's probably really comfortable with what a deductible is with health insurance, and your deductible resets every calendar year. Whereas for us, the way that it would work for a new illness or injury, so when someone enrolls, they're going to choose what we call is the initial unshareable amount. We call it an IUA for short. So the IUA is the amount that you're responsible for paying for each new medical event that occurs. And then whatever amount is beyond that for that particular medical event is what New Health would share in or pay for. There's three options that someone can choose from. There's $5,000, $2,500, and $1,000. The lower the IUA, the higher the monthly membership fee, but you won't be responsible for more than 3 IUAs per family per membership year. So 3 things could happen to me. And then if one thing happens to my husband, we don't pay an IUA for his injury because we already paid 3 for my really bad year. So like, let's say I woke up with appendicitis, for example. Maybe emergency surgery comes out to be $40,000. I would submit the unpaid bill over to New Health. They actually go through the bill to make sure it's correct, which, by the way, we find that 83% of medical bills have a medical error on them.
Oh,
And
wow.
then it's insane. And then we help by negotiating that bill down. And on average, we lower bills by about 46%. So let's say New Health is able to drop my bill to 20,000. It's just as simple as I pay the hospital my IUA of $1,000, and then New Health sends me a check for the remaining 19,000 so that I can pay the rest of my bill. And then if anything else is needed for that surgery or that illness, I just continue to submit it and New Health continues to send me checks. So unlike a deductible that resets every calendar year, an IUA never resets for a medical condition until you're symptom free for a year. So in this scenario, if I had insurance and my surgery was in December, and then I needed another surgery for that particular illness in January, I'd have to hit another deductible. Whereas with an IUA, it never resets until I'm symptom free for a year. So that's something that makes it really different. Now, also, if I ever have an illness or injury, and maybe I want to seek out an alternative treatment, right? Maybe I want to work with a functional medicine doctor. Insurance typically wouldn't pay for that, neither would most other health shares. With New Health, you just have to fill out an alternative treatment plan, which outlines the benefits of the treatment, the cost of the treatment. We might ask for some doctor's notes, and we approve them on a case-by-case basis, in which case, if it's approved, I just pay my IUA and New Health shares beyond that. So also something that makes this much different. What else? We spoke about customer service. I can't tell you enough. You can call, you can email, you can hop on chat. If you have a question about something and you have another question about it, we try and have you speak to the same person so that you're not repeating yourself over and over again. So it's just the experience we try and have people really have. And by the way, for everyone listening, if you haven't seen our reviews on Trustpilot, I recommend going on there. We are very proud of our 4.7 out of a 5-star review. Everything I'm saying with how much our members appreciate everything is all there. So you can see it firsthand what they say.
Absolutely. Now, what about pre-existing conditions? So I'm assuming, that most people listening have Hashimoto's, or at least they suspect they have a thyroid issue.
Right.
So tell us about how that works.
Sure. Yeah. So we consider a pre-existing condition to be anything from the last 2 years that you've either been diagnosed with or have symptoms of or have been treating or taking medication for. In which case, if something is needed for that condition in year 1, it's not shareable. In year 2, we can share up to $25,000 for it. In year 3, up to $50,000 for it. And then in year 4 and beyond, $125,000 a year for that condition. Now, that being said, we have many members who have various autoimmune conditions and thyroid conditions. However, given, again, the pricing that we spoke about with Evexia and blood work, which is usually something that, I'm sure you run every couple of months, at least once a year, you're saving a lot of money on that. So like I mentioned, a thyroid panel is $15 and you can order it yourself without your doctor's order. Now, medications is something, so my maintenance medications we do not share in. However, we give great resources like GoodRx and Single Care, which are websites where you can get coupons at the most affordable pharmacies near you. I've seen, various thyroid medications for less than $10 on there. So it's another great way to help with those costs as well.
Wow. Yeah, when I was talking to different companies, I called different pharmacists and I was looking at labs and I wanted to look at every single detail, every single data point
Yeah,
because I didn't want to go on emotions or advertising or anything. I wanted to look at the hard data and I definitely after calculating everything, we are saving money definitely with New Health making that switch. So even knowing that, nothing for Hashimoto's is covered for at least the
right.
first year, we're still saving money. So
Yeah, absolutely.
yeah, many of my listeners use functional labs. So I'm assuming we can get those through Evexia. And then what about like food sensitivity testing or hormone panels? Like
Hmm.
insurance will deny those. What happens here?
So if it is for something pre-existing, that wouldn't be shareable in year one. So there's a lot of different testing. There's different tests available through Evexia. Like I know they have all different panels and things you can do to test for food sensitivities. So it is going to be much more affordable to use it than to do it in person. So something related to allergies, that would be something because it's again if you're already having symptoms of something, it would not be shareable in year one. But in year two, for something related to an allergy, any allergy testing, curative treatments, and medications are eligible up to $2,500 per need. But the tests do have to be ordered through a traditional MD. So if the testing is ordered by like a functional medicine doctor or integrative doctor, it would not be shareable. But as long as it's through a traditional MD, then it's up to $2,500 starting in year two.
Okay. And then you mentioned pharmacies and coupons and stuff. What about a compounding pharmacy if somebody's getting medication through one of those?
So in general, if you need a maintenance medication or a medication for something that's more acute, like if you just need like an antibiotic for strep throat, that would be something you would just pay for out of pocket, which again are generally pretty inexpensive for something like an antibiotic. If you have a new medical condition where you're paying an IUA, then we would reimburse you for that medication for up to a year. So, regardless of how you get the medication, you would first be responsible for your IUA, and we would share, anything beyond that, including the medications, for up to a year.
Okay. So if I have four kids and like
Yep.
say someone has a sore throat, I feel like it might be strep.
Yeah.
What happens in that case? You
So there's a few things, right? So if you wanted to see someone in person, because it's something that's less than your IUA, you would just pay for with a self-pay discount. So, I mean, I know my pediatrician charges maybe $80 for a sick visit. However, if it's something you wanted to use maybe telehealth for, we reimburse you for that as many times as you need it. And we let you decide on the telehealth provider because it's always about freedom of provider. So if you don't know of any, we give you some resources in your member portal. But if you have a preferred website or a doctor that you know of that does telehealth, you can use them and we reimburse you for it as many times as you need it. Now, we also give our members a ton of different resources in their member portal. One of them is actually a medical supplies company, which carries at home strep tests. I paid $60 for, I want to say, 25 strep tests. And I can swab myself and my kids at home. And then if I show telehealth a positive strep test, they can call in a prescription for it. There's also a lot of states where you can just walk into a pharmacy and they can actually test you at a pharmacy as well. So there's a lot of different tips and tricks that we help give people to navigate the system a little differently and to make it more affordable. But yeah, that's a great way to navigate strep.
That is fantastic. I ordered strep tests back when Amazon sold them, and all of my
Oh,
tests are now expired, and Amazon doesn't sell them anymore. I'm super excited that I can get in-date tests. Yes,
yes,
I've still used
exactly.
them. I like just test, the positive and negative controls to make sure that it's still working.
Yep,
But it would be good to have some in-date tests. And for anybody
exactly.
listening who's like, oh my goodness, I could never swab somebody's throat, are there YouTube tutorials, or how would somebody who's not a nurse do that? Like, how do you do it?
Yeah, you can look it up on YouTube for sure. I mean, they do show pictures in there. For me, it's easier than some of my children. I have kids that are 3, 5, and 7, so it's not always the easiest. But you know, their father helps with it. We just watch some videos and we talk them through it. But it's nice that I don't have to leave the house, right? I don't have to expose my kids to anything at the doctor's office. I don't have to travel. I can do it all at home myself. So it's great.
Wow. Okay, so we've talked a little bit about families and, those well child checks and sick visits. What about empty nesters? Now, moving on to, people who are retirement age, they're often looking for long-term vitality, but a lot of times they also have like several different conditions. What does an average retiree experience at New Health?
So the membership ends once someone turns 65.
Okay.
Okay. But we have a lot of people who are at that in between phase of their life where they're retiring, but they're not able to apply for Medicare. Right. So this is a great way to have an in between. I mean, we generally do have healthier people who enroll, but we actually make three exceptions for pre existing conditions. They are high blood pressure, high cholesterol, and diabetes. So, as long as you have not been hospitalized for any of those in the last year, we don't consider them to be pre-existing if you're just able to control it with diet and or medication. But if they do have some sort of, other pre-existing condition, it would not be shareable in year one. That being said, we tend to draw in people who are healthier and who, like a lot of people, they aren't using their health insurance and they're spending a lot of money on something they're just not using unless it's something catastrophic that they're looking for it for peace of mind, which is what we're here for, right? That's why people come to us in the first place, is for the peace of mind for something large. I think that's the best way to think about that.
Awesome. Awesome. So somebody who's feeling like they're ready to make the switch, what is the first step to join New Health? And then how can they use the affiliate code that you gave to me?
Yeah, absolutely. So you can hop on our website. It's newhealth.com. There's a pretty quick little calculator button that you can just put in your information. And you would just put in, like, your age, where you live. It'll tell you your costs. So it'll tell you what your monthly contribution will be according to the IUAs. It'll show you all the options. And what we're doing for all of our listeners is giving you 20% off your first year. So there's a little box where you can put a referrer name. And when you enroll, you can put this in the code. There's going to be a code section, and you want to use HWH20. Okay, so that's going to give you 20% off your first year. So the first thing, if you want, is just use the cost calculator on the website. It'll tell your price, and then we can call you, or you can call us with any individual questions that you have remaining. We're all really lovely. Like Esther said, we just want to help you really figure out if this is the next best step for you. But if you feel like you've heard what you need to hear and you're ready to enroll, the membership always starts the first of the following month. If you need to defer your membership, like Esther did, you can enroll using the code and just email us and let us know when you want to begin. So if you enroll in November and you want a membership to start January 1st, you can email hello@newhealth.com and say, hey, I just enrolled, but I want to defer my start date to January 1st. So the payment you would make in November would be for your January membership, and then we won't charge you again until January for your February membership. And those instructions are going to be on the application when you enroll as well.
Awesome. Is there anything that I should have asked that I didn't ask? Any like common questions?
I'm trying to think. We went through a lot. We didn't touch upon maternity. I can
Oh, okay.
quickly kind of,
Yeah.
people who are thinking of growing or starting your family. So New Health shares in everything from prenatal visits to ultrasounds, blood work, whether you want a home birth with a midwife or a birthing center or a hospital, your postnatal visit, the baby's wellness in the hospital, their wellness check. We also share in pelvic floor therapy, chiropractic care, and postpartum depression counseling as well. So I wish I had New Health when I had my babies. The only difference is that regardless of the IUA you enrolled with, everything related to your pregnancy is a $5,000 IUA instead. Okay, so you would be responsible for 5,000, and we would share in the remaining costs. There is a wait period for maternity. The estimated due date has to be in the second year of membership. So it does not mean that you have to wait until year 2 to become pregnant. It just means that you have to wait about 90 days from when the membership begins to conceive in order to put the due date into year 2. But, we share in more for pregnancy and maternity than any other health share. We share in more preventative than any other health share. We also give everyone a full script membership. So it gives you 35% off of all vitamins and supplements that you order through Full Script. They have all the highest quality brands. We give everyone a Fit On membership for on demand fitness and nutrition classes. And we give 2 free health coaching sessions to everyone each year. So our health coaches will take a look at what you're eating and your lifestyle and just make some small suggestions that might go a long way. We also have a medical concierge. So anytime you need something like an x-ray, an MRI, CAT scan, even your mammogram, colonoscopy, you can contact us and we can help you find it at the most affordable location near you. If you ever need a surgery ahead of time, you can ask your doctor and hospital for a quote and submit it to us. And we'll actually let you know if you're getting a fair and reasonable price. And if you're not, we would attempt to negotiate it ahead of time or even pay for you to get a second opinion elsewhere. So, the negotiating is a really big piece to what we do. A lot of other health shares leave the negotiating to you. I don't know about you. I don't know how to negotiate a medical bill, nor do I have time. And if you think about it, whether a bill is 20,000, 40,000, 100,000, you're only responsible for your IUA that you chose. However, the fact that we're doing as much as we can to negotiate the bill and get it lower truly affects the whole community because it's less that's coming out of the fund, which is in turn helped us keep our rates at the same price for a little over 6 years. So that's how it directly impacts you as a member, is that because of how much we're doing to keep all of this care as low as possible, we haven't had to raise our rates. Other health shares raise their rates every couple of months, every year. But we do things very differently on the back end. And this is what's helped us with keeping our rates as low as possible.
Wow. Um, One thing you said is that everybody gets 2 health coach visits. Is that
Yeah,
per family or is that per
per
member?
person.
Okay.
Per member. So each member gets 2 free health coaching sessions each year. We have in-staff health coaches that you can make an appointment with through your member portal. They have little bios, and you can choose the one that resonates with you. And if you wanted to continue after those 2 sessions, they give you options to do that. And you can always use that self-care credit that I mentioned earlier to help get reimbursed for up to $200 for health coaching if that's how you wanted to use it.
Awesome. How does that work for kids and teens?
So they are for adults,
Okay.
so it's 18 and over, but they might have some resources for some people that work with children. So you can always reach
Mhm.
out to us with any direct questions about that. It's hello@newhealth.com, and we can help you with that too.
Awesome. Oh my goodness. I have learned so much in this interview, and I already learned a ton when I called you guys earlier. And you're absolutely right. Every single person that I've talked to on the phone or an email has been so personable and friendly, easy to talk to. I know some people get really nervous having to make a phone call, but
Yeah.
I don't even remember like a robo like option, like please dial one for this. And it was just a real person. It was so refreshing.
Yeah, that's what we want to do. We'll always speak to a real person. You will never get directed to a random call center. So we're trying to kind of put that human touch back in healthcare. Again, it's just always easy to get in touch with someone because we know that it could be a stressful situation, that you have questions about, that your health is on the line. And many people are doing this for the first time. It's a little nerve wracking, and we just want to be here to support you, through everything.
Right. Danielle, if somebody's listening and they're a little overwhelmed, what is one thing that you want them to remember from our conversation?
Oh boy, one thing. There were so many. Um, we really do just want to help you and support you and just help you make healthcare more affordable and attainable. Healthcare, I think I read that Americans are drowning in more medical debt than any other type of debt. It's medical bills that are causing them to be drowning in these bills this debt every month. And we just want to make it easy and affordable. And that's what we've done with this. I'm hearing people get quotes from their health insurance for thousands of dollars a month. Like you said, it's like a mortgage payment. And we don't want to, have that hinder someone's lifestyle. So, if you have questions, like I can't stress enough, just give us a call and we're here to help you and help navigate you through this. It is different from health insurance, but I like to think it's better. Not biased being a member or working for the company, but it's what, our members say. It's just a completely different experience from any other healthcare company, including other health shares. We just do things very differently. So I know that there are some people who were listening who may have been part of a health share and maybe they didn't have the best experience with them for different reasons. I can guarantee we are different from them. So just give us a call and we'll really tell you all about that too.
Awesome. Thank you so much for coming on the Health with
Yeah,
Hashimoto's
this was
podcast.
fun. This
Yes.
was fun. Thank you so much for having me, Esther. I really appreciate it.
Yeah, you're welcome. And thank you. All right, here's the disclaimer. This podcast is for informational and educational purposes only. Please discuss any questions or concerns with your healthcare professional. These statements have not been evaluated by the Food and Drug Administration. Products mentioned, I don't think we mentioned any products, but anyway, products mentioned are not intended to diagnose, treat, cure, or prevent any disease. I'll see you next week on the Health with Hashimoto's podcast.